or
I
shall
think
I?
Miriam should share the slides.
Okay, great. So you want to share them for me as well?
Yes.
Great. Hello, everyone. Good afternoon. Nice to see you. Ah, so many sunny, smiling faces. That's lovely. We're really pleased to be on session 4. I can't believe we're getting close to being halfway through our together sessions. And delighted to be with you for this discussion around leadership and systems thinking. If you want to pull up the agenda perhaps next, Miriam, I think that's the next slide. So we're going to do a little bit of checking in and follow up for just a moment. And then we're going to dive into some deep discussions with Miriam leading us around leadership and systems thinking. Miriam is doing this because she spends all day long doing this kind of deep systems thinking in a way that has really been extraordinary to me as someone who's spent a lot of time with leadership at the US CDC and at WHO. It's really impressive to me the way that Miriam's able to synthesize these multiple pieces. So we're going to all benefit from having some guided discussions from her. And then we'll do small group discussions as we did a couple weeks ago and as we'll be doing regularly. And then we're going to debrief. So first though, on the next slide, I just wanted to show you guys, if you could go forward one slide. Thanks. So we're just wanting to check in about our completion data for you all that, as you can see, both on this slide and in a second, not quite yet on the next one, not quite yet, go back, that many folks are doing really well in getting most everything or everything completed, but there are some folks who are not, and you can see across the top there what the different activities are that need to have been completed. You want to show the next one now? Thanks. And the totals for folks who've done each of those categories. So I don't know what I'm experiencing. Oh, I see. Okay. Very good. It's not a problem. Glad to have you in by audio. And this will all be, of course, available recorded, as it always is, on the course site, so that you can go back and look at anything that you didn't get to see that's important. So with these data, we went to folks at WHO and said, what should we do about folks who are not completing quizzes and activities? And this is what they said. So essential for us to maintain course quality. As you know, we've considerably decreased the amount of time for readings and also decrease the amount of time for activities while still addressing the competencies that we said that we would address with reasonable fidelity. But it is essential that the activities that are required get completed. Happy to extend the deadlines for them. That's fine with them and fine with us. But certainly try to get these pieces done sooner rather than later, remembering that for the quizzes that you have 3 attempts to pass them. And here I am reminding the learners, hoping that that's useful. But just to repeat the bottom line, to be able to get the certificate and complete the course, you have to complete the requirements. And if you have questions about this sort of thing or any other pieces, please feel free to contact us through the through the site, and we're delighted to address your questions. Okay. I think that is it for my intro part, and I'm going to turn it over to Miriam.
Thank you, Erica. It's so good to be with all of you today. Oh, am I muted? Can you guys hear me? Good. Okay, I do want to warn you, I am at home with 6 children who have COVID, so we're quarantined and I couldn't bring in a babysitter for public health reasons. So there may be a little bit of noise in the background, so just bear with me. Today we're going to be discussing health leadership as it relates to systems thinking. In the first part of the talk, we'll consider how systems and complexity science has helped us address 2 major health concerns. And then we're going to talk about systems thinking as it relates to leadership. So what is systems thinking? Systems thinking is an approach that contrasts with traditional analysis, which studies systems by breaking them down into their separate elements. Systems thinking can be used in any area of research and has been applied to the study of medical, environmental, political, economic, human resources, educational systems, and many others. So instead of breaking things all the way down to their parts and just doing that, you look at them in their parts and then you look at them as a whole. Complexity science is concerned with the complex systems and problems that are dynamic, unpredictable, multidimensional, consisting of a collection of interconnected relationships and parts. Unlike traditional cause and effect or linear thinking, complexity science is characterized by non-linearity. In other words, complexity science helps us understand chaos. So let's contrast systems thinking and complexity science. They're more alike than they're different, and the terms are often used interchangeably, but there are some small differences. And the big difference is that with systems thinking, your focus is on extracting and analyzing all information. With complexity science, there's a lot more admission and room for interactions that are poorly understood, difficult to measure, and when considered, help to make sense of a larger situation. So you can think of complexity science as the science of studying the unknown. An example of complexity science is how birds flock together. And you would think, oh my goodness, it must be so complicated because they're doing this beautiful movement. But it's actually really simple. Each individual bird follows 3 rules. Separation, they avoid crowding with neighbors. Alignment, they steer towards the average heading of their neighbors. And cohesion, they steer towards the average position of their neighbors. But that's it. Just those 3 rules make the beautiful thing that we see in the skies every day. So how can systems thinking help us understand the influence of economic, legal, social, and political factors that influence the health of populations? So I'm not going to go through all of this because you guys are already experts. Instead, we're going to look at a case study. So let's think about the HPV vaccine and cervical cancer. And let's think about complexity science systems thinking as it relates to public health initiatives to reduce the incidence of cervical cancer. In 2012, 270,000 women died from cervical cancer. There's a proven relationship between this disease and HPV infection. We've had a vaccine since 2007 that's 99% effective against the 4 most common types of HPV virus that cause cervical cancer, but the uptake has been quite challenging. There's been opposition on the part of the population, some health professionals, and others. And why? Why do you think, guys? Why is there opposition to HPV vaccine?
Well, the HPV vaccine is being offered to younger persons, which it would be children between the ages, I believe, up to about 11, and then it goes up to about 20 something. And I believe that there is a consideration that these children are not sexually active and that contracting HPV has something to do with having sexual intercourse. So I know that that's one thing that we've picked up.
Excellent. You're absolutely right. Does someone else have another idea about why the population or healthcare providers might resist HPV vaccine?
I think that there is a anti-vax movement now, so that it would affect the uptake of the HPV vaccine.
Excellent. Do you guys know the proven most effective way to help parents overcome their reluctance with vaccine? A very strong recommendation by a trusted healthcare provider. That's the most effective way to help parents with their reluctance towards vaccine. So another piece that some parents are quite worried about is who manufactures the HPV vaccine. Merck. So do you guys remember Vioxx? Anybody remember the big Vioxx scandal? Like, it was a big deal. Thousands and thousands of people died from a drug called Vioxx that was also created by Merck, and Merck went out of their way to conceal that data. So one of the big concerns of a lot of people who are anti-vaccine is they're concerned about a company that created Vioxx having also created the HPV vaccine. So how does a company re-earn trust? And that's a huge piece of the puzzle when we're making and thinking about manufacturing, disseminating, and evaluating vaccines. How do you have a trusted organization or company creating that vaccine? Who's benefiting? And how does the money work? Those are all really important questions when we think about the manufacture of vaccines. Any other ideas about why HPV vaccine may have met some resistance? Is that enough? Is sex and corruption enough? I think so. So we have this cervical cancer, and we know we can prevent it with the vaccine. It's not 2007 anymore. We've done tons and tons of studies. The vaccine is proven to be safe and effective. So what can we do as public health leaders to improve uptake and use of the vaccine? Paraphrasing, the main difference between reality and fantasy is that reality has infinite detail. And the better we understand this detail, the more precise our responses will be to problems that may arise and threaten the health of populations. So it's one thing to say, oh my gosh, those anti-vaxxers, they're so stupid. And it's another thing to sit with a mom and explain to her why she should give her kid Gardasil when her grandfather died after taking Vioxx. But when you get into the details with people and they start to really listen and you can show them that the vaccine is safe and effective, that's when they can start having uptake. And so you can deal with these different situations with different approaches, and it really is important to pay attention to the details. And now we have a new vaccine that was just approved in December, Gardasil 9, and it covers 9 variants, and 99% of cervical cancer can be avoided with this particular vaccine. Have any of you guys started administering it through your health departments? Or yes, Valeria in Spain? Yeah, good. So even with these huge barriers to uptake of the vaccine, here's what's happened to the incidence of cervical cancer in Australia. This is Australia, and this is the US. And this is France. And so we're looking, and here's where you guys live. So this one's a little more complex to look at because it covers multiple countries. And it looks like the incidence in some places is actually going up, and others it's going down. So we see disparity here between high income countries and low income countries and what's happening with their incidence of cervical cancer. So look what public health did in a very short period of time. We've seen a dramatic decrease in the incidence of cervical cancer. And now we're going to talk about this other virus, this new virus that we're dealing with. So can we make the COVID-19 pandemic go away? What do you guys think?
This is Candice Alcantara. I don't think we can make it go away. I think we will find ways to manage it, um, just like we found ways to manage other diseases.
Thank you. So how can we manage it? Let's apply what we've learned from considering the response of various healthcare systems to HPV virus and consider various possible responses to SARS-CoV-2 virus. We'll consider ways that complexity science and systems theory can affect design, delivery, and evaluation of healthcare. What intervention would be the most effective in ridding us of the virus? What do you guys think?
Well, this is Dr. Philippe from Ministry of Health, Bahamas. The intervention, I suppose you're leading us down the path of a vaccine would be one intervention, but also behavior change will be another intervention. And then of course you have, intervention at primary, secondary, tertiary policies might help also.
Absolutely. So a simplistic response would be, well, if we get a vaccine, we'll fix it. But we know that even when we have a very effective vaccine that's safe, it can take decades to really fix it. So let's hold this question for a moment and consider some other information. The pandemic hasn't affected all countries equally. There are many factors that affect the spread of the virus. Let's use systems thinking and complexity science to model the interactions among variables and develop tools that allow us to generate hypotheses that will guide the efforts of health systems and reduce the harm caused by the virus. What questions might we ask to develop a hypothesis that could lead to decreased transmission? How many of you are familiar with these causal relationships that loop back onto each other? The models that are developed from them, they look something like this. And you can see in a model like this, many different factors are included, including things like accountability of authorities, trust in authorities, public perceived risk, and then simple things like number of infectious people, number of cases detected, perceived number of infectious people, and all of these things interact and inform each other. Systems thinking allows us to understand complex interactions, as is the feedback loop present between the perceived number of infectious people and the personal and social measures to control the infection. When the former begins to decrease due to control measures or the decreased ability to test and detect new cases, for example, personal and social measures to control infection will be relaxed, transmission will increase, and we'll have periods of disease reappearance and disappearance. Subsequent return of control measures may occur. So That's exactly what's happened in Minnesota. That's where I live. How about where you guys are living? Have you seen this fluctuation? Yeah, getting a nod or two. So let's begin to imagine a world with a safe and effective vaccine. Would we be able to create a plan that addressed the complex variables such as trust and authorities to ensure maximum uptake of the vaccine? So what are some essential components of effective public health interventions? Innovation, the technical package, performance management, partnerships, communications, and political commitment. So with innovation, we're looking at areas of science and medicine, information, systems, data collection analysis, issue framing, operations, program management and evaluation, communications, innovate, and all of these things are essential for developing technical aspects of program implementation. And then we look at a technical package, small number of synergistic evidence-based interventions that can make a major impact on specific high priority goals. Performance management, the rigorous real-time monitoring and evaluation of incorporating feedback mechanisms to ensure continuous program improvement and avoid misplaced confidence and results. Partnerships with public and private sector organizations. Communication that is effective at overcoming the objections of groups like anti-vaxxers, and then political commitment, the will to make it happen. So what did we see related, if we go back to our example of cervical cancer, how did different countries address each of these 6 pieces to get to an effective plan that caused a decrease in cervical cancer? I have really enjoyed looking at Australia's public health system recently in a number of different areas, but particularly in cervical cancer. And one of the things that's been so fascinating is they've developed a national data system for tracking test results. And we don't have something like that in the United States. But no matter where a woman goes or travels, her physician can always access the data related to her cervical cancer, or when the last time that she's been tested, or when it's coming up. So that's great. There's this system that centralizes data, but also allows it to be accessed in a dispersed network. There's also a number of new innovations. So we have the vaccine that was just approved in December, but in addition to that, we have the new HPV test that's much more accurate and doesn't require a speculum exam. Additionally, the requirements for testing have changed, so it's not nearly as often. And all of these things working together, issue framing. So there's been a lot of work done around the destigmatization of cervical cancer and comparing programs and results from one country to the next. So Australia thought they were doing great, but then they took a look at New Zealand and realized New Zealand was doing a little bit better. So they spent a lot of time asking themselves why. And I think they came up with some really good answers that will improve their own outcomes. So that's great to look at what other people are doing and then iterate and improve upon it. So can some of you who'd like to respond, go ahead and unmute. And I would like to hear from you. How are you applying these 6 things to your response to COVID-19? What are the innovations, the technical package? What performance management systems are you using? What partnerships, communication? What's the political commitment to address these issues?
One of the things that we're trying to do on our end is use all the feedback mechanisms to gather information on what the public is really thinking. So in the early stages of COVID, we had a lot of misinformation going out via WhatsApp. And so we tried to use that same mechanism to push the accurate information out. Um, we get a lot of emails and comments and messages via social media, which are very helpful. And they feed into, for example, what we would focus on next for the next press conference, or what things we think we need to adjust the wording or terminology for. Um, because a lot of times, you know, in communication, you focus so much on pushing the info out, especially in a pandemic like this, that you forget that you need to get information back and use that to guide future decisions.
Wow, that's amazing that your organization, your system is so responsive to the public. That's really great. Would anyone else like to respond?
Yeah, I would like to respond. I'm really glad to hear that they are, you know, ahead of the curve. I think for us in the Bahamas, we are developing our partnerships with community leaders in the Community Health Committee. There's a Patient Family Advocacy Committee, as well as Equality Bahamas and the Department of Gender and Family Affairs, as well as Civil Society Bahamas. More recently, there was an issue about antigen testing and the uptake, and there was a differential, um, you know, the ministry was concerned about people going ahead without having the information. And so they asked for feedback. So it was amazing to send out to the community group that the Health COVID EOC needed feedback from them about certain issues. And within 24 hours, we were able to have a Zoom meeting. They were able to give their feedback virtually on the concerns they think the ministry needed to address. Was able to present that at the Health COVID EOC on Wednesday. We were then instructed to work along with the Ministry of Health Communication Department, as well as the Health Education grouping, to ensure that the technical information really met the objectives of the community. And we're utilizing the document called the Risk Communication and Community Engagement Planning Tool that was developed by WHO, the International Federation for Red Cross and Red Crescent, and the UNICEF. And so it's really beautiful to see the government, the Ministry of Health, civil society, NGOs, and other government organizations having this virtual partnership and communication, and that there's a political commitment to support it.
That's wonderful. Thank you. I think we have time for one more person to respond. Do we have someone else who'd like to respond and talk about how your workplace is using innovation, a technical package, performance management, partnerships, communication, and political commitment to respond to COVID?
I would love to. I think I have liked really much Kale's example of antigen testing. We have implemented those too, and I think with that example only, we can evaluate all of these steps, because that was innovation. But then we had to start with technical support, because we were doing that in primary care and anyone else could see that it had been done. So we had to implement some technical innovation there, so everyone in the system could see it. Then we had to manage everyone, so everyone could see and perform again according to that. We had the tracers to see that and to identify all the positives and to track them, isolating them. We have to have communication with the teams, with the people on the front. We have to have communication with patients. And we need to transfer all this information to engage politics here and to have some activities done according to the numbers and everything else.
Thank you, Valeria. It's fascinating to hear what's happening in places as diverse as Spain and the Bahamas and how everyone is responding. Thank you. So how do we use systems thinking to prepare our organizations to respond to an increasingly complex world with higher numbers of threats? So we've done a great job over time. If you add time to the mix for cervical cancer, tremendous progress in the last decade. And COVID is probably going to take a while too. It's probably going to take a decade to really see the changes that we'd like to see in these systems. So, and there's probably more bugs coming. So how do we prepare our organizations and ourselves to respond in increasingly connected, dynamic, and complex systems? So is your organization, are you encouraged to think of your organization as a machine or as an organism? And does it matter? Organizations can be treated as complex adaptive systems, and they exhibit the fundamental complex adaptive system principles like self-organization, complexity, emergence, interdependence, space of possibilities, coevolution, chaos, and self-similarity. CAS, or complex adaptive systems, are contrasted with ordered and chaotic systems by the relationship that exists between the system and the agents which act within it. In an ordered system, the level of constraint means that all agent behavior is limited to the roles of the system. In a chaotic system, the agents are unconstrained and susceptible to statistical and other analysis. In a CAS, the system and the agents co-evolve. The system lightly constrains behavior, but the agents modify the system by their interaction with it. I'm going to say that again. In a complex adaptive system, the system lightly constrains the agent behavior, but the agents modify the system by their interaction with it. This self-organizing nature is an important characteristic of a complex adaptive system, and its ability to learn to adapt, differentiate it from other self-organizing systems. So the most important piece to remember is that in complex adaptive systems, we actually use all of the different pieces. We use the coevolution, the self-similarity, the chaos, the flex, all of these things create the flexibility, creativity, agility, and innovation that we need to survive in this increasingly complex world. So here are some principles to guide us as we lead in complex adaptive systems. A good enough vision. So how many of you have spent hours and hours and hours developing a 3-year strategic plan? I have, too many times. But we don't live in a world that follows a linear process and follows that strategic plan. Usually by Q2, I'm ready to throw the strategic plan in the dumpster and light it on fire because things are not moving according to plan. We need to have a good enough vision, a simple vision, a vision that people can follow and provide a true north, something that we can always point back to. We need to provide as leaders minimum specificity. That means we don't want to micromanage. If we micromanage, we're not allowing the complex adaptive system to do its job. Minimum specificity allows the agents within the system to use their own creativity to get the job done. Self-organizing teams, we allow the agents in our systems to self-determine. And this can be really scary if your team isn't used to it and you're not used to it. But does it work, Valeria? Yes, it does work. We ask the wicked questions. They're the questions that nobody wants to ask or feels comfortable asking. We ask them, we surface them. At NextGenU and the other organizations where I lead, we call this combining radical honesty with radical kindness. We don't just ask the wicked question and walk away. We frame it, we contextualize it, we ask it, and we stick around until we've come to solutions. We identify the shadow systems where the real power is. So in my system, do you know who has the real power? My executive assistant, who manages my calendar and all the folders and knows where everything is. So in our systems, it's not necessarily the person who's at the top of the box in the org chart who has the power. You really look at organizations and how power works, overlapping circles, and everything is interconnected. So we want to identify the shadow systems. We ask people, where is the power? We talk about these systems, we make them explicit, and what is in the shadows, we bring it into the light, and sometimes we drag it into the light. But when we do this and we make these shadow systems explicit, the organization can grow and change and move and adapt with a lot more ease. When we do these things, then comes emergence. And emergence comes from complex adaptive systems, and it is when the discrete parts, you look at the discrete parts and it just doesn't make sense because what the organization is producing and the impact in the world is so much more than its discrete parts. Okay, why do we lead this way? Not easy. We lead this way because it works. It may be difficult at first, but this challenging path does lead to good results. We, as leaders in complex adaptive systems, we guide, not decree. We empathize before we advance. We understand the inside ourselves before we demand from the outside. We wage peace and not war. We weave networks and don't cut ties. And we channel opinion, we don't dam it. So let me talk just briefly about each one of these. Guiding, not decreeing. Okay, so I've been with teams in the field and it's been dangerous. And there are times where I have to bark orders because it's literally very dangerous and I need to keep my team safe. In a clinical environment, when you're coding a patient, somebody needs to stand up and run the code. There needs to be that decreeing. But that should be such a small part of the way that someone leads. Should be 2%, 1%, less, depending on your setting. So we guide, we don't decree. Empathize before advancing. So when you're asking your team for change, you prepare your team for change before you pull them into that change. We understand the inside before demanding from the outside. That's being self-aware, knowing our motivations for what we're asking before we meet the ask. We wage peace and not war. It's easy in organizations to, especially when you are in an organization with multiple departments, or you're interacting with a lot of other organizations in a competitive environment, to use the language of war. But we want to wage peace, not war. We want to weave networks instead of cutting ties. And we want to channel opinion and invite the expression of it and not damn that opinion. So that's a lot to say, and it's a lot to say without giving examples of how we've seen this done. So I'm going to talk for a moment about 3 of the organizations where I'm providing executive leadership. And I'm going to talk first about Nurses International. So Nurses International is an organization that displays emergence. And the way that I know that, or I feel confident in saying that, is that on a very tiny budget with a group of volunteers, we're providing nursing curriculum to 124 countries. So how does a tiny little organization with this very small budget do something like that? Well, because it's working as a complex adaptive system. So we have a small group on our staff. We have a large group of volunteers, and then we have a much larger group of users. And all of those systems, the volunteer network, the staff, and the users, those systems interact in many complex ways. But as we adapt to each other and meet the needs using our operating framework, we're able to display the characteristics of a complex and adaptive system. Erica, could you talk for a moment about how NextGenU uses complexity science in its operation?
Yeah, sure will. And I think it's easy to integrate that with some of the things that I talked about in our first session together, because NextGenU is a reflection of multiple communities that I've accumulated over the decades. So I mentioned last time that a colleague of mine from the American Medical Women's Association, for example, was the person who linked me to working with DuPont. Well, same kind of cumulative piece, but multiply that by multiple decades. So there are the systems that we tap into go all the way up to deliberately cultivated relationships over decades with senior leadership at WHO, and all the way down to my child and his friends' parents, because I talk incessantly about NextGenU and they get excited about it. And so it's very clear to me from a personal relationship in building NextGenU, but also having done a 3-year fellowship at the Stanford Center for Research in Disease Prevention and learning about community-oriented primary care, that everyone brings complex systems. Every patient brings complex systems as well. So I would encourage you all, as you ponder this talk, to think about what kinds of complex systems do you experience in your personal life, and that help you make very profound health decisions, as well as those of your constituents.
That's such a great point, Erica. So the question is not, are you part of a complex system or not? If you
Do you
are,
recognize it? Yeah.
how are you going to cope with it? Are you going to try to pretend it's a machine because that's more comfortable? Or are you going to recognize it's a complex system and you need to adapt to it? Richard, I wonder if you'd talk to us a little bit about the complex system that is People's Uni.
Yes, thank you. I think that the 2 points I'd like to pick out from your list, first is vision. And I think the importance of having the vision that everyone can share. The second thing is self-organizing teams. And the way we work in People's Uni is we have a number of modules that are delivered, and they're delivered by volunteers. And each module has a team, a self-organizing team. They develop the module, they deliver it. They have a leader of each team who's more of an organizer. And I think that's the key. We then have infrastructure or support from IT and various other groups, but every little group works on its own and shares the vision, and together the complex system sort of evolves, and that's how it evolved.
Thank you. So these 3 systems with global reach evolved over time, and I'm interested to hear about how your system uses complexity or thinks about systems. Now these 3 organizations are a system of systems. So these 3 organizations are working together using agile principles and complexity science to create the world's first global health science center. So it's already, let's see, 46. So I don't think we have time to split up into small groups. Erica, do you want to split into small groups, or should we stay as one big group and maybe do some of the discussion? Yeah,
That's fine. Yep.
great. So I think I'm just going to stop sharing my screen and I'll paste again the discussion questions into the chat. And we'd like to hear from you. What workplace challenges have you experienced related to systems and complexity, particularly in the time of a pandemic? I'm going to stop sharing, and then Hugo or Valeria, if you could paste the questions in, that'd be great. I'm not able to. All right, who would like to answer that question? Maybe someone that hasn't contributed yet. What workplace challenges have you experienced related to systems and complexity?
So in my workplace where I work in a chronic disease clinic, we have the challenge of trying to provide for continuity of care for the chronic diseases, despite having a COVID pandemic ongoing. So it takes a lot of coordination to try and troubleshoot and see how we can not only reach the patients, but cater for their chronic disease needs, as well as any other complaints that would have been addressed in the clinic. We need to be able to contact them. So we've been, using telemedicine, trying to contact everyone, but then not everyone we are able to contact, at the time when we call. They may not be there, or they may not have a contact. And then we try to coordinate it so that they don't actually have to come and collect their prescription or their medications. So it's a lot of different factors that we have to take into place, the individual needs of the patients, as well as making sure that the clinic still runs, so that we don't have, in terms of their chronic diseases, if it's more controlled, and if they do get COVID, they're less likely, because these are the patients that are higher risk. So there are a lot of different factors that are interplaying with each other. And that provides a challenge for us, because initially we had started out with just trying to write prescriptions for everyone. And then it evolved into us having to call the patients and touch base with them. And then it interacted with the pharmacy to try and coordinate to get access to the medication. There's so many different factors that we had to troubleshoot, and the plan evolved as it went along. So that now I see that there was a lot of systems thinking in how it was coming. At the time, I didn't realize, but now knowing about it, I realized, well, there were many different factors, and we were doing it on the ground without even knowing the theory behind it.
Yeah, well, now you know, and you can take it back to your group. One question that Dr. Heller brought up last week: how many people are not getting care for other conditions because everyone is so hyper-focused on COVID? I know someone who went to the ER 3 times with appendicitis and was turned away until her appendix ruptured, because everyone was like, well, you don't have COVID, go home. Yeah, so how do you take that into account? And it sounds like your system is actually doing a beautiful job of following up with people with chronic illness and in a time of an acute pandemic. That's great. Somebody else, would someone like to respond to the question, are you expected to treat your workplace as a clock or a living organism? Maybe you're not ready to talk about your current workplace, but you can talk about a workplace in the past. That would be fine too, if that's more comfortable.
I could give an example from the health promotion perspective. We would have normally gone out, are you hearing me? We would have normally gone out to schools or to workplaces to implement health promotion programs. And we had to revisit some of our programs to determine how we could actually still interact with populations that are not dealing actively with COVID, and namely young persons. At the beginning, it felt as if we were just confused or we didn't have a plan, even though we were thinking actively about how we could approach it. But after a while now and applying the systems thinking approach to it, I could see that we had to review and rethink how we actually were dealing with the idea of health promotion for youths and thinking about how we could incorporate the virtual setting. So now we're at that point where I can definitely look at applying systems thinking to see, probably in review or in hindsight, how we actually have been doing it in this new phase.
That's great, because the next time we have a new bug, you're gonna know exactly what to do, or you're gonna have a mental map of how to approach it. And that's amazing. That's really important. We had someone raise their hand. Anju?
Hello, good evening. Yes, I wanted to respond to that question in terms of are you expected to treat your workplace as a clock or a living organism? Now, I have a small unit where we're involved, surveillance and epidemiology unit, where we are involved a lot with the contact tracing. And sometimes I think I look at this question as people think we should be working as a clock and not as living organisms. Sometimes I understand our work can be around the clock, yes, but sometimes we become overwhelmed when there are a lot of persons that we do have to keep up with in terms of follow-up through contact tracing. And sometimes these people may call after hours, weird hours in the night, 11, 12, 1, and we're expected to answer the phone, and sometimes I think, yes, we're trying to help persons as much as we can, and as best as we can, but sometimes it can become overwhelming. So all of us know we have to try. So I have to try to keep my team motivated to continue to deal with this, because sometimes they don't get any sleep, or sometimes it's just they have other things to do at home and so on. So it's just to keep them motivated, and despite these challenges and despite people might not be the most kind when you're dealing with them through this COVID situation. So, but we are living organisms, because if we continue to work and work and work and work, we will burn out, and then there won't be anyone to actually do the work. So,
yes, thank you. You should connect with Valeria afterwards. She could tell you a lot of stories, and I think it'd be great for you to see how a contact tracing team in Spain is feeling so similarly to the way you and your team are feeling. I think Dr. Frank wanted to talk, and then we'll go over. Go ahead, Dr. Frank.
I just wanted to put in a little endorsement for this notion of thinking about systems as being living organisms. I think for those of us who've worked in large public health systems, as you all do, and as I have at CDC and WHO, the ability to be able to think that these are actually other human beings sometimes gets drowned by a desire for efficiency. But what Miriam has taught me is that the most efficient thing is to recognize that the most complex systems are those that exist between people. And if you don't recognize that and cope with that, your other efficiencies will evaporate. So this is not just a feel-good notion. It's a let your organizations run better notion. So just wanted to put in that little plug.
Thank you, Dr. Frame.
Thank you.
We have Dr. Nessie, I'm sorry if I'm mispronouncing your name, Dr. Nessie Tong.
That's correct. That's absolutely correct. I wanted to kind of just touch on the first question about your greatest challenge in your current workplace. For me, it's a little different because in the beginning, well, let's just put it this way. I've been the director acting for about 4 months now. So it's a relatively new position for me. And I was originally working as a district medical officer, just a general doctor, running all over the place, doing contact tracing, swabbing, etc. But then I was taken from my position as a clinician and placed in a managerial role with a zero managerial experience. So the shoes that I had to fill was actually shoes that were worn for like 5 years. So my whole approach to everything was very different from what all of the admin staff was accustomed to. So I had to deal with a lot of like kickback in the beginning, and proving yourself. So for me, it was the adjustment of being a clinician and now being the manager and having to look at every aspect of primary health care and have it holistically as a body and manage it from the top. That was truly challenging, and to win the trust and the respect of everybody that works with me. And at first I was working as a clock. We were like around the clock, the COVID cases were just increasing. And then I remember at one point I was like, you know what, we need to stop. We're all going to burn out because it's the same people over and over again. So we had to come together as a team and divide and conquer. And I don't know how I've been able to do it, but it's been working. So it's a challenge, and it's also understanding that as a unit and as a body, when we work together, we can really get a lot more done. So that's it for me.
Can we just give Dr. Nessie Tong a hand as a new manager? That's really hard work.
It's hard work. It's very hard work.
Good job. Good job doing it.
Thank you.
In the middle of a pandemic too. It's a lot of. All right, let's do question 3. What public health problems or concerns are you experiencing right now that could benefit from a systems approach related to COVID? I think I'm going to go to the last question if no one's responding to that, because we're running out of time. What has been your biggest success or challenge in leading within a complex system?
I would like to say, from my experience, one of the challenges is knowing how to balance everyone's needs. So knowing how to balance the patient's needs, also remembering that you have staff. So you also want to balance their needs as well as you want to achieve certain outcomes. So it is sometimes you have to really evaluate how to take away from one area and add to another to ensure that everything operates smoothly. So that has been a challenge at times.
Thank you. Does anyone have a success that they'd like to share in leading within a complex system? How about you, Hugo? Can you talk a little bit about leading within a complex system?
I think that a success is definitely this course because this included participations from people from different places of the world, so many people reviewing the content, so many people helping on doing the quizzes, the activities. it's just difficult to remember how many people was involved, how many steps and iterations were needed to make this happen. And being here together, I think that is an amazing success for us as a team.
Thank you, Hugo. Let's do one more. Does someone else have a challenge or success they would like to share that's occurred while they were leading within a complex system?
Right. Hi, I'm Dr. Bristow. I'm similar to Dr. Nesty Tong and Dr. Jones. We all were in clinical positions initially and trusted into managerial positions as a result of COVID. But I think one success coming out of this is, in terms of leadership, is that sometimes as a clinician, you see things differently. And then having to make managerial decisions, I kind of use some clinical skills to make those decisions. A leader would have to make some difficult calls at some point in time. And related to COVID, sometimes making those difficult decisions do pay off. For example, in determining in our setting, we had to choose who would get tested for COVID-19 and allocating limited resources to a large population at one point in time. Now that testing has become more readily available, it's seemingly better. But I think, now in my case, we have varied our testing approach a little bit from what was initially mandated, so to speak, because we've seen in our own setting that some patients, for example, for COVID, have continued to test positive and have zero symptoms. And in terms of my testing approach for my county, I had still continued to test some people who had zero symptoms, who were primary contacts and asymptomatic. And we were able to capture a significant amount of people who were walking around positive. And actually from our own data sets, we've picked up almost 28% of patients who are positive, who are primary contacts and asymptomatic are positive. And I think that's a significant amount of people who could have been missed if we had just stuck to what was mandated of not testing anybody who didn't have a symptom. And I think in that regard, we probably would have saved some lives from people who may have been exposed to possible spreaders.
Thank you. Dr. Frank, would you like to close us out?
Yeah, sure. Both I and I think Dr. Rojas will as well. And I just wanted to mention, though, first to Dr. Bristow, I hope that you'll write those findings up and submit them for publication. It seems like that's a nice way to document your leadership and to let others benefit from it as well. Happy to talk with you about that on the side if that would be helpful. So, Dr. Rojas, do you want to summarize what's going to happen over the next week until next Thursday when Dr. Heller will be leading our discussions? Hugo?
Yeah, sure. Just as a reminder, all the deadlines now are open, but we are still recommending to keep the original deadlines to make sure that you don't get too much work for the end, but feel free to catch up later if you have some difficulties. This Friday, tomorrow is the recommended deadline for the quiz and activities of Module 2, the ethics module. And next week, we will be talking about capacity development. You will have the learning resources available today. And Dr. Richard Heller will be leading us in next week's discussion.
Super. And Dr. Nesty Tong, you were wondering about if the time has changed for...
The time has changed in the US. Eastern time, I think, is different now.
Yes, it's an hour earlier. Yes. Good. Oh, and I'm glad that that feels responsive to you. Thank you, Dr. Philippe. I'm glad that that's useful. And yeah, we want to be helpful and considerate. We're really excited to be working with you all here. So good. All right. If there's nothing further, then that's it for this week, and we'll look forward to seeing you a week hence. Please be in touch if you have questions. Thank you. Bye-bye, everyone.
Bye.
Thank you. Bye. Great time.
Bye.
Bye.